This week on the Post Call podcast, we have a themed show. It's all about devices and not medical devices, your personal devices, your electronic devices, how much time you spend on them, what can happen, what are the risks, what are the benefits, and what we can get out of this. Our interview this week is with Sarah Morajan. She is not a physician. She is a professional social media expert. She teaches class at the University of Southern California. She's going to talk to us about things like medical, Instagram influencers, and how to be professional on Twitter and Instagram, risks, benefits, theories. It's going to be very exciting. And Emi Okamoto, MD, is here, of course. Emi, I cleaned my house and I found my Fitbit. It's a great day.
Did you move at all?
No.
Yes.
So
That's the key.
Yeah. Well, it's been gone for weeks. So what I tried to do is set an alarm so that the buzzing of it, I could find it. Didn't work.
Yeah.
But today,
Yeah. Well,
I found it.
yeah. I bike to work now.
You did that here. Well, congratulations. That's maybe a bit of home routine for you in Cambodia.
Yeah. Yep. Lots of motos, but still doing it.
Lots of motos for Emi Okamoto. That rhymed.
Locomoto.
Emi Locomoto. Love it. So welcome to the Post Call podcast. We had a special edition last week about physician suicide. Physician suicide awareness happened earlier this week as we record that. So if you missed that episode, you can find that in the previous episodes. A lot of people were kind of talking about it on Twitter. So we thank everybody who worked on that from our sister show, the Psychcast by MD Edge. Psychcast will occasionally have physician suicide and physician mental health stuff. Anytime they do, we'll put a link to it and we'll talk about it on the show. Okay, Emi, we want to talk about devices this week because there are a couple of interesting things going on, articles that we found on Medscape. I want to start with, as we do our little reading club here, this opinion piece by Dr. Sunil Ohand. I think I pronounced that correctly. If you spend more than 80% of your day staring at a screen, you are no longer a doctor. Agree? Disagree?
Yeah, it's hard because that's what doctors do these days.
Right.
But I will say her last name is definitely Dond.
Dond?
I
Okay.
think the D, the O, the...
Oh, it's a D. It's not, yeah. So here's the deal, guys. I apologize for that. I am having my second endothelial cell transplant coming up. So eventually, this time next year, I'll be able to see like a real adult.
Yes.
So it's Don, Sunil Don, Dr. Sunil Don. So 80% of your time, you're a data entry technician at that point, right?
Yeah. He ends the article saying that, if this is you, you're no longer a doctor or a nurse. You've become a data entry bot.
A bot, yes.
Which so many of us feel. Yeah, it's a lot of time. And he references that study I think we talked about earlier, how they followed interns around and about only 10% was direct patient care, which is why we go into medicine, to be with the patient, to be, invigorated by caring for them and their responses and their reactions. And it's turned into computer time.
Yep. And not only that, but it's not only computer time, but it's kind of mindless computer time. Because my job is computer time, right? But I do the thing I want to do. This is entry of data, which is not what you wanted to do. And the really upsetting thing to me is that there are people who really like doing that kind of work and are trained to do it at a high level. But we've got the people with the highly skilled, like elite 1% medical training just entering things into a computer.
Yeah, which he brings up the point too, do you do scribes? Is that kind of your solution?
Mobile devices,
Yeah, at some point you will have technology advance so much that ideally technology can just pick up the salient points and put it in. We're pretty far from that though.
Yeah.
But I have seen that pitched before.
Yes, me too. I don't know if we're talking about the same thing where you think like eventually, I know that without getting into any branding that people can guess, there will be voice-activated devices that kind of want to look into that, and it's always getting more accurate. Or do you want it to be able to pick up on the conversation in your office or in your exam room? I'm a little touchy about that, but maybe not.
I saw a pitch for not only does it listen to the conversation, but it writes a note based on it, which Good luck in my clinic ever following my unlogical stream of thought with my patients.
Right, which is that's
But
another interesting part of this. But here's the question: is it going to be more accurate than you finishing notes at 1 a.m. or
yeah,
less accurate?
yeah. Or a week later. Gosh, when you can't even remember left from right and who this patient was, it's certainly a burden for us and affects patient care in a lot of ways. You're
Yeah.
not
Oh no,
in
no.
front of the patient, you're not staring at them, so
Right, which to me is like it's something that literally in the first interviews we started doing for this show when we launched it more than a year ago was doctors are not doing doctoring anymore, which is sort of the problem.
mm,
And like EHRs are they are the best and they are the worst because um, they really can make a huge difference. The fact that as a patient, I've said this over and over again, you exist in 3D time and space. Everybody can know what's going on with you, but the fact that like it's kind of my doctor, right? It knows all the stuff. It has everybody like it's like it's me in a medical record. It's you in a medical record. It's kind of taken over the relationship.
sure, yeah. And I think you or someone on the show was saying it's a glorified cash register.
Yep.
It's a
Yeah.
lot of data input and not necessarily for the right reasons.
Sure. So that
But
okay.
one day we're getting there.
Yeah, it's great to have the internet and blogs because people keep blogging about that stuff, and that number is really alarming. So we got some new numbers for you from an MD Edge Frontline Medical Communication survey. Frontline Medical Communication, of course, owned and operated by WebMD Medscape. We surveyed 1,700 physicians across 16 different specialties. All of the data are available in detail in a white paper. If you want the entire paper, you have to sign up for our job board. So if you're looking for a new job, you sign up, you tell us something about you, maybe you want to move or just see what's out there. It's always nice to flirt with potential openings. But we're going to give you the highlights real quick. And building off of what we just talked about, the average physician that we surveyed spent 208 minutes per day on electronic health records. That's nearly 3.5 hours. Crazy.
Yeah. Oof,
80%.
that's a lot of time.
Found that people want to be well read as well. 89% of physicians engage in print publications and journals in some way as part of a way to obtain medical information. So print is not dead. Holla.
Yeah, yeah. Oh,
Um,
it's loaded on my site. Virtually all physicians visit medical websites daily for an average of 34 minutes a day.
it's nice to stay up to date.
Which,
You can do stay up to date at mdh.com.
yeah.
Exactly. Yeah. 40% of physicians said they prefer print and digital as part of a multimedia strategy. So whenever you hear print and digital, all that means is reading instead of watching videos or listening to podcasts. So 40% said that they preferred print and digital. I think that people don't consider themselves readers. We're all readers, and reading has never been more popular than it is right now, and this is proof of that.
Yeah, well, I think it's print and digital. So I
Yes.
think that paper's not dead.
No,
A
definitely
lot
not.
of people like I underline and highlight and tab things and then it sits in a pile.
There is data that suggests that there are studies that suggest that holding it in your hand is a different cognitive experience, and you remember it
Mm.
better.
Interesting. Yeah.
Another interesting finding is that 40% of physicians or MDs do not engage with podcasts. We need to look into that a little further to see if it is to specifically acquire medical information or if it is any podcast at all. Because you could be listening to popular shows like Pardon My Take or the Joe Rogan Experience or Serial, and does that count as engaging in the podcast? And you obviously worked with the Curbsiders and you work for us now. And what do you think about using this platform as a way to obtain relevant clinical information?
I think it's great, particularly, especially once you get in the hang of podcasts, because podcast just delivers information in such a unique way that is a passive experience that you can be doing anywhere. We hear a lot of feedback for the podcast saying, I listen going to work
Yep.
or on the train ride or things where otherwise you just be like staring into space, kind of like disliking the person next to you or something.
Right.
But it gives you an opportunity to really utilize time.
Right. I like it because specifically I don't want to toot the horn of my industry, but I like it because I had found that music had become really stale, and I know that if you really like it, and I like deep tracks as much as the next person, and I like popular music as much as the next person, but it seems all sort of similar, and there's too much. I find it really refreshing that people are getting into podcasts because it means that you're looking for information, you're looking for human connection, and not just listening to music as a way to not be where you actually are, not to just kill time with your ears. So, and then also people are putting a lot of effort into it and creating real communities around their show. So I'm a big fan of it, but 40% said they don't engage at all. I suspect that number is going to go down a little bit because as podcasts become more accredited for CME, it'll be a really good way to kill two birds with one stone. So instead of just listening to get clinical information and be entertained and learn about, your specialty or whatever, stay up to date, it will eventually, I believe, have a real impact. And you can do that on your car. Maybe you memorize some stuff and take a quiz and get, a quarter credit or 3/4 credit.
Yeah.
I definitely think that's the future. So there's these one more piece of data. About half of physicians use some form of social media professionally. And I think that's an important distinction because a personal account, you want to talk to your friends or just say what's going on, or maybe you want to read about politics or sports or whatever on your Twitter feed, or, see how your kids or your whole ex-boyfriends or girlfriends are doing on Instagram is different than your professional representation on social media.
Yeah, and what's interesting is there's so many platforms, and in this infographic they have a lot of pictures. I'm going to see if I can name them all. There's like Twitter.
Okay. Yep.
There's Spotify has the things. Yes, there's Instagram, Facebook. That looks like Google Voice with the phone.
Yes.
Google Play.
Maybe I'm thinking that's WhatsApp actually.
Oh, WhatsApp. That is WhatsApp, the phone. And what is the @ sign?
I think that's just.
Gosh.
I actually don't know. I think that might be a representation of email. I don't know.
Yeah. Pinterest? No.
Is it Pinterest? I would never know.
No, I don't think so. Yeah.
So.
You haven't planned a wedding, have you?
No, I have not planned a wedding, which I hear. But I also heard there's a good place to learn about like workouts and diets. But I can't. I have app fatigue. I've downloaded as many apps as I want to download.
Oh yeah, no, Pinterest is fun. You can just save pictures like random. It's another way to bookmark things and always come back. Yeah.
So those are some. If you want the full report, you can find the link in the podcast notes, and want to find out some stuff about your career goals and maybe sign up for our job board, you can get that in the show notes. So as we talk about all of the bad parts of spending so much time in front of your screen, there is another vulnerability that we wanted to talk about, and that is cyber attacks, hacking.
Yeah, hacking. This was just such an interesting article on that came out in Medscape this past week. And yeah, it goes on, telling the story of when Dick Cheney got his new defibrillator in 2007, the doctor disabled the wireless capabilities, which is like, yes, because you are a target for cyber attacks. But it's not just Dick Cheney, right? It's anyone. Hackers can remotely get into your car system and your voice control system and any connected device, and they're just kind of highlighting that the FDA recently took notice of this issue, and there's starting to be conversations about how vulnerable our medical system is.
Yeah, I'm not a fan of the Internet of Things. Are you familiar with the movement Internet of Things?
No.
It's when it's a device that is in your daily life that is connected to the internet. The famous examples that people are kind of most freaked out, including myself, are your door locks, your fridge, and your car. Because if they're connected via Wi-Fi as a device, like it can turn it on, turn it off. Like people love Nest. I have Nest. That's Internet of Things. Internet of Things to me is it's just another way to get hacked. I watched a video where a woman. She's awesome. I love her. Her name is Runa Sandvik. She's sweet. Everybody should check her out if you're into techie nerd stuff. She was at the Black Hat conference in Washington, D.C., a famous hacker conference, and she's a reporter for the New York Times. She hacked a gun at a training facility for the U.S. military. It was an AR-15. She hacked it and deoriented the scope and pulled the trigger while it was in someone's hand.
Oh, my gosh. What?
Yeah.
Stuff's crazy.
Yes.
I know. Oh yeah, but so the medical devices, just like our insulin pumps, our defibrillators,
right, exactly.
everything are just fatal devices if hacked.
Right, and so that this is
And
like, if she can do it to a gun, or someone can hack your fridge and make all your food go bad, or take over the car that you're driving, imagine if you had something inside of you. This is a really big vulnerability, and it's easy to kind of gloss over and be like, that's some sci-fi stuff. No, people know how to do that, and they will ransomware your stuff, and they'll get money, and they'll mess with you.
yeah, and guess a typical hospital bed has how many wirelessly connected devices? How many do you think, Nick?
Man, I want a ballpark 7.
Double it. 10 to 15.
10 to 15. So that's
Yeah.
all just opportunity to just get right in there.
Just alarms and telly and the bed. I don't know what else is actually
don't know
electric.
either.
That's a great question. Yeah, but there's
CT
it's a
scans. I'm
very
reading this says CT
interesting
scans, and
article.
they're demanding $1 million in ransom. And what are you gonna do? Not pay it?
Yeah,
You know, like that's someone's life. So there are. I don't know if everybody doesn't know some of the terminology. A black hat is someone who is a hacker and kind of messes and has like deviousness. A white hat is someone who can do that but is on the side of good. I mean, it's pretty self-explanatory. So there are looking for white hat hackers who can expose these things. And I know that I read years ago that in medicine, hospitals were the number one target of ransomware because of the ability to, completely ruin people's lives. Medicine is actively recruiting and kind of looking for white hat hackers to expose this stuff. But man, it is freaky.
Yeah, if you're looking for a job search, as we were
Yeah, if you can,
publicizing,
if you can hack an entire hospital system and something that is inside of another human being via the internet, there's probably
we
a lot
will
of
hire
opportunity
you.
to do good.
Yes.
Do good. Do not hack Dick Cheney.
Yeah,
It's way too late for that. So I want to talk about our guest this week. She is a social media expert. I saw her doing a Twitter thread, and the Twitter thread was about Instagram influencers who are doctors. Now, Instagram influencers are, of course, people who have huge amounts of following, and they're celebrities. They're kind of famous for being famous. More and more, there are physicians, nurses, other sorts of clinicians who are gaining a following. We've had a few of them on this show, and one of our favorite guests, Shannon Toussanian, Dr. Toussanian, who has 50-some thousand followers. Shani
Dio.
Shani Do. I like Shani Do. It sounds like a doo-wop song.
Shani Do.
Shani Do.
Yeah.
She's an influencer, quote unquote. She has the ability, the platform to be an influencer. But now, like Sarah Morja was talking about how there are pharmaceutical companies and device companies who are getting these influencers together, these medical influencers together, and paying for stuff, and like who needs to disclose what, and who's going to write what prescription for what now. It's really kind of weird waters that medicine hasn't really been in before, and so we get into that. And it's going to be a pretty interesting conversation just because there isn't a lot of specific regulation on this.
Great. That does sound really interesting. I can't wait to hear it.
Well, basically, if you want to know about influencers, you got to watch the Hulu or Netflix documentary about Firefest. That's FYRE. And about how people who are famous can just be paid to post stuff, and maybe they don't believe it, or maybe it's just completely fake and doesn't exist. And I know that Emmy's going to go home tonight, or I guess it's nighttime in Cambodia as we record this.
Yeah,
You can watch it right after we get done recording this, and then you'll understand the problem.
Yeah.
That's your
or
homework.
I'll just go to bed.
I'll just go to. What you texted me? You said you were making dinner. What'd you make for dinner? Are you trying the local stuff?
Yeah, I had some local mushrooms, which looked like odd little bubbles. I don't know.
How were they?
Different than your normal mushrooms. They were good. The first few I ate were covered in bug spray, which was on my fingers.
On your fingers?
Yeah. The next few, once I washed my hands, were all good.
All right, we'd like to hear that. So coming up after the break, interview with Sarah Morja from the University of Southern California. Emmy, next week we have the host and creator of the Nocturnist podcast, a medical storytelling podcast that is just amazing. And I'm really excited to have Dr. Emily Silverman on. So thanks so much for calling in from Cambodia. And just remember, try to stay off your devices 80% of your time. Unbelievable.
Yes.
Welcome back to the Post Call Podcast. I am talking with our guest this week, a non-physician guest, the first time since one of our very first episodes. It's Sarah Morja, and I found you, I think, on a Sunday afternoon. You were doing a thread about influencers with regard to pharmaceutical products and doctors. Thanks so much for coming on.
Thanks for having me.
So the thread was really interesting because I think, like most people who have Netflix, I watched both Fyre Fest documentaries, and then that's when I learned what the hell an influencer is, and it blew my mind. And now your thread talking about pharmaceutical products and healthcare influencers was really fascinating and really prevalent. Something we focus on this show is how to get physicians on, Instagram and Twitter and make them feel comfortable. And is it educational? Is it like self-promoting? What's your presence? What's your vibe like? So we just talk a little bit about physicians and healthcare professionals on Instagram as influencers.
Mm-hmm. Well, I think it's an interesting area because it's evolved so much, and it's something that's really taking off in the medical field. And while you were just asking about physician influencers, I did want to mention that this week is the first week of instruction at USC, and right now I'm teaching my undergraduate course, Social Media for Scientists and Engineers. And what we did was we went through the first case study of the course, which was on Kim Kardashian and the FDA. So you might be asking, what does Kim Kardashian have to do with the FDA?
That's exactly what I was going to ask.
Yeah, well, back in 2015, she posted a picture on all of her social media platforms of her holding a bottle of this medication called Diclegis. And in her post, she said that this morning sickness pill had no increased risk to the baby. Now, obviously, that's not the case. Every medication has risks associated with it. So the FDA sent a warning letter, I think it was 2.5 weeks after that post was live. So it's a really interesting area to explore because what I do in the class is I go through each step of communications and what she did to correct it. So I can dive a little bit more into that if that sounds interesting.
Yeah, it does. I kind of wanted to, we'll touch on something similar because in my job, when we talk about medical media, these sort of the red tape surrounding biotech and pharmaceutical products is something that I know about and I deal with. And I find often, and I suspect, honestly, a lot of NFL players might get into some hot water with CBD and marijuana down the road. But that's obvious to me and obvious to the audience. But what are the challenges and what makes it different? And I guess Kim Kardashian would be a really great anecdote, I suppose, for why the FDA is involved and how can someone with a platform like her, which is just astronomical, almost unreplicatable, compared to maybe just a doctor or a medical student, and how does the healthcare realm play into what's happening for influencers?
Sure. Well, I think the biggest issue is the fact that the public has a tremendous amount of trust in physicians. So being able to post on behalf of yourself as an individual is very different than posting as a medical professional. So I think that's a layer that's really unique to the area compared to other fields. So, for instance, I'm sure some of the influencers you've heard of, the big one is Dr. Mike on Instagram. And when I look through his profile, what I find interesting is he has a lot of photos that are outside of the hospital and the clinic, but a lot of these also have scrubs, and it's clear that he's practicing medicine. So when I see that type of presence, I think that the public will look at that and say, is this person posting on behalf of themselves or on behalf of the medical profession as a whole?
Which is that's really fascinating. It's like sort of saying, like, you see this on Twitter a lot. I think and this is so weird to say and so counterintuitive to what's going on in the real world. Twitter is more authentic in medicine. Twitter is a great place for educational conversation. There's open dialogue, and ratios are the opposite. You want 100 comments and 10 likes and no retweets is good. But and all of these people have, the doctors who participate in these kind of conversations will put, these reflect my opinions. That's not medical advice, and it's not necessarily the opinion of my employer. And it seems so redundant to see that, and maybe not that important, but it really is important to say, like, hey, this is not, by interacting with me on Instagram, you're not going to the doctor.
Mm-hmm. Definitely. But I think even with those little disclaimers, if people see MD or DO, they are looking at whatever message is putting out as being officially from the medical community. So unfortunately, it's the case that with physicians, there's no clocking in and clocking out of this profession, because a doctor is a doctor, whether in the hospital or outside of it or on Twitter. So.
Which is a really fascinating aspect of all of this. So I want to talk to the thread, and I think that I hope that you'll remember the day that we got in contact. It was about a Botox product, or a product similar to Botox, raising awareness and how to do the disclaimers for what the side effects were and who was posting what. So you just talk to me about what that thread was and what you were talking about with regard to disclaimers and who's posting what.
Sure. So this thread was about the Botox rival, and it's from this company, or the product's called Jeuveau, but their social media campaign is around the hashtag #NewTox. So I'll just be referring to them as #NewTox. Sure. And what had happened was, back in May, the New York Times came out with an article about this #NewTox and how the company had brought out 300 physicians to Cancun to go and party, and there were a lot of issues with this because the physicians didn't say that the company was sponsoring their trip, but they were asked to do all these social media pushes around the hashtag #NewTox, and nowhere in those posts was it evident that this was all done for free. So there were a lot of issues with that, and I think once this came out, I thought for sure that this company would likely cut back on their approach to engaging the medical community in that way. But it turns out they haven't, so I would definitely encourage listeners to check out the hashtag on any of the platforms. And let's see, so just walking through this, what I find so fascinating about this company is it's very clear that they're catering to a specific audience. If you look through their branding, it's all very sleek and social media friendly. So to me, that says it's being branded for millennials. Now, in this thread that you mentioned, I go through and I say that it's interesting how they're doing this, because one tweet in particular, they have a link to the box warning and medical guide, and it's a link to a separate Twitter account that only has a tweet that's scrolling through all the important safety information. So that's something new that I haven't seen from pharmaceutical companies before. And it's interesting because on that account, there was a comment and somebody said, "Hey, this is too small. I'm reading it on my iPhone." So there's definitely some concerns over how to be properly advertising and getting those warnings out.
Go ahead.
Oh, no, go ahead.
I was just going to ask how that I saw that video you're talking about, and it's literally just a screen grab of like a quick scroll up and down and like really, really fine print. It reminded me of the sped up 5 seconds at the end of a radio ad where like, well, I guess legally that counts, but it's not practical. And I sort of, and I kind of hate to say this, but that makes sense when you're advertising to the lay audience. You see this exact tiny fine print at the bottom of the screen for a bunch of different ads, pharmaceutical or otherwise. But if your audience are healthcare professionals, someone clicked on that and wanted to read it. So what do you think the challenges are? And is this, circumventing law, or is this just a place where the law hasn't really caught up to?
Yeah, so that's a great question. I actually was skimming through the FDA social media guidelines earlier today, and they specifically want a link to whatever the black box warning is. So legally, it does check the box, but you're absolutely right. The person would have to go that extra step to try and find the information so that it's big enough to read.
Which is really, really interesting. That sort of does what is the purpose of the campaign. It gets you to the website to read the stuff, right? Mm-hmm. Which is really interesting. So who are the audience of influencers for medical professionals, for doctors? Who follows doctors on Instagram and Twitter?
On Instagram, it depends. I think mostly what I'm seeing is it's a general audience. It's also other medical professionals. On Twitter, it's seemingly other people within the medical community. I'm not seeing too much engagement between physicians and patients, and there's always exceptions to the rule, but outreach efforts. So it tends to be very much in reach and within the medical community where those conversations are happening.
So in the last couple of years, it seems like this has been springing up. Are there any trends that you're noticing with regard to the way these companies are using influencers? Because influencer culture is such a good way to get messaging out. And I guess for the audience who doesn't know what influencer culture is, will you just explain what influencer culture is?
Yeah. I was thinking about this, and honestly, an influencer is famous for being famous. They yeah. I know that's terrible to say,
it's exactly right. Yeah.
Yeah. So that tends to be the case. Living in Los Angeles, I tend to see a lot of people who are trying to break into being influencers. And on Instagram, it's just people are looking to be picture perfect, editing photos, having the perfect light. And seeing this in medicine, I think, is a little bit concerning. But on Instagram, what I am seeing is it's mostly, I've been seeing a lot of these scrubs and stethoscopes that are companies that are doing advertising there with influencers. I don't know if you've seen these.
Yes, the scrub companies are things that I've seen pop up quite a bit. And I guess that makes sense. What a great way to advertise. The scrub companies typically have trendier, better fitting. They look more like clothing.
Mm-hmm. Yeah, exactly. And when I was teaching at the medical school a couple of weeks ago, an incoming student said that he was actually approached by one of these companies. So that was fascinating.
Yeah, I think so too. I guess I can say that, and this is where it gets weird for me because they are famous. These people are famous for being famous. And if anybody's watched the Firefest documentaries on Hulu and Netflix respectively, I highly recommend it because it kind of goes into how much power people yield by making themselves kind of a commodity. Mm-hmm. We've had recently 2 people with audiences big enough to be considered influencers, but they both balked pretty hard at being called influencers. I think this sort of happened to them by accident. I don't think that they're shirking their responsibility as influencers. This is, of course, Shani Dio on Instagram and Dr. Skin and Smiles, who was our episode not too long ago. And they both said, this is something I don't know if I want to go down that road. I like to use this platform for, positivity and maybe encouraging other people who are trying to go down the road that they're going down, which is what they get out of it. Being healthy as a doctor, budgeting time for yourself, eating right. But at the same time, when you have that, double-digit or 5-digit following, you have an opportunity to turn a profit on that, even if you wanted to make it for a pizza company or 7-Eleven. But is there a difference between advertising from a mainstream company and what do you think, if this happens to a doctor, what do you think they should do?
So let's see if there's a difference between advertising versus influencer advertising.
Yeah, advertising for a general public company, say Blue Apron or a delivery service versus advertising for a pharmaceutical company. And then if someone accidentally gets 10, 20, 30,000 followers, how do they navigate those waters?
Yeah, I think there's a big difference because it comes down to risk. So if a influencer is posting something that's medically related, the big risks are associated with that. If the message is misinterpreted, personally, I would feel a lot of liability and feel really bad if somebody took some advice from me that was medically related because of the product that I was pushing. So I don't know. For me, that would be the biggest difference.
And so if somebody finds themselves in a situation where their following is going up from 1,100 for people that they mostly know, and all of a sudden, and it happens overnight, I'm told, over a year or two, where it goes from 1,000 to 2,000 to 10,000. If somebody finds themselves in a situation where they have this kind of power, and they want to exercise their opportunity to capitalize on it, whether with message or financially, what is your advice to them for being safe and but also getting the most out of it with that, with your message or with your money?
So I have to tell you, one of the most concerning things that I've heard, this was a few years ago, I was giving a talk in Egypt, and during a Q&A, a student stood up and said, "How do I make my science go viral?" And I just had a chill went through my body when I heard this. I think follower counts will go up over time, and if somebody's in the position to have their content go viral, it's very important to just take a step back and think about what brand you want out there, because it's very easy to have these missteps and then all of a sudden be known for a certain area, I guess. So I tend to tell people not to really worry about the follower count, worry about the message, because it's very, very easy to get too involved and too critical of what our analytics are on social media. But in doing so, I think we lose some of that authenticity, and the audience has a bigger pull and a bigger sway. Oftentimes, actually, this came up in discussion yesterday when I gave a talk at SDSU. There's a certain equation to these viral posts, and I think that people need to be mindful of that and do their best to be authentic rather than playing into it. Does that make sense?
Yeah, no, that totally makes sense. I think that the people, I'm just kind of racking my brain, the people that I know that have gotten to these big follower accounts, and specifically, I'm talking about Shani Dio, who was with us about 6 weeks ago. She told us that this all started when she was in medical school. She just posted pictures of her doing yoga, and all of a sudden kind of happened to her, but she hasn't swayed from that at all. And I think that's really important. I also keep hearing that if the goal is to create audience, that's when failure happens. But if the goal is just to kind of reveal yourself, then you're more set up for success. Is that something that you've seen?
Yeah, and I love the way you phrase that. I might actually use that.
Oh, great. Well, if you'd like to offer me a professorship at the University of Southern California, just be in touch with my agent.
That's good.
I appreciate that. So the other thing I wanted to get into a little bit was who you are. You're one of our first non-physician guests, and this is a really important topic. Social media is really disrupting the healthcare space. Quality information, if you know where to find it, I suggest Twitter, and a lot of disinformation from non-influencers and a lot of quote-unquote pseudoscience. But how did you get into this kind of work, and what's your motivation?
Sure. So a few years ago, I was working at Caltech, and I partnered with Chemical Engineer to create the course Social Media for Scientists and Engineers. And I currently teach this at USC in their School of Engineering. So that really started things. And what this course is we believe it's the first full-length 4-credit higher education offering that dives into the issues and opportunities of using social media in a professional capacity. So I took that course and really started to expand beyond it and found that medicine was a very interesting area as well. And when I moved over to USC, my faculty appointment was not at that point in medicine, but the dean at the time, he heard about what I was doing in engineering and said, "We have to get her up here. We want her to build a program." So back in 2017, I started to look into what's happening in the medical profession and how these interactions are occurring online. And I just built these case studies, and from there began teaching. And luckily for me, I had this opportunity was amazing. The access that I had to students was incredible. So in 2017 and 2018, I had 3-hour workshops with first-year medical students, and they were very interactive. So I got to test a lot of material, and we deep dived into some of the things that they're seeing right now on Instagram with influencers who are advertising things to the medical community and then also to a general audience. So there's a lot of nuanced details to these things, and having them work in small groups to explore what's good and what's bad about them, it makes for great discussion.
Yeah, it's such a weird time. I really feel fortunate to be alive right now when this is kind of a new frontier with a lot of, and it's, I call it the Nobel complex. I'm sure somebody much smarter has come up with a better name, where like Alfred Nobel invents dynamite, which is giving you everything that's ever been mined and roads and all this stuff, but it's also, a weapon of mass destruction. I find the internet and constant connectivity to be very similar. Some of the medical education Twitter threads that I read are so enlightening, and you think these are people who are going to bring this tweet to a patient tomorrow, and they probably would not have had access to this information 10 years ago, 20 years ago, 30 years ago. Use the instance of Mendel's genetics stuff sat in a dusty library for decades before anybody found it. But on the other hand, there is the possibility of disinformation and maybe incorrect information, or just some straight money grabs for things that maybe your heart isn't in, that you just want to make the money off of. So let's get into the kind of the nitty gritty of what's really going on in influencer culture and in the medical community with disinformation. What are some of the things that you've seen on Instagram that kind of concern you?
Well, one case in particular, and I'm not going to share the name of this person,
Sure.
but it was very enlightening to see this. This is a fourth-year medical student who was advertising a teeth whitening kit. So he had a selfie and the kit right next to him. And what was interesting about this was the product itself. I know you and I in this conversation, we can say that that's not a medical product, that's a cosmetic one.
Sure.
But talk to other people and they might look at that and say, this is a medical professional who's providing informed advice about this. So that's come out in conversation. And not only that, this post, it's an amazing example of what not to do. In the actual comment, he posted a discount code that people can use when they purchase it. And by using that, he gets a percentage of the sales. But the code that he had used was doctor and then his first name. So if you use this and Dr. Sarah, and you'll get 90% off this product.
Right.
So I shared that with the medical education department, and they were shocked to see that a fourth-year medical student was doing that, and even more shocked to hear that paid sponsorship is happening and people are receiving free scrubs for these sorts of things. So I think those types of things definitely bring up a lot of concerns with ethics. But yeah, sorry, I just went off on a little...
No, that's exactly what I'm trying to get. Yeah, that's exactly what I want. That's a great example. Yeah, no, it seems like people who are in charge of a lot of bodies of education and information in sciences around the world are not of the age to have grown up in influencer culture, but someone who's a fourth-year medical student or a medical school right now is so literate into what's going on online that it probably just seems normal to them, and the people who are in charge don't possibly have enough information to, on the day they walk in the door, present a slideshow and say, these are things you probably shouldn't do, and these are the things that will get you sued and kicked out. And I hypothesize that that's where the disconnect is.
Absolutely. And a lot of physicians that I talk to, they actually avoid social media altogether and say there's too much trouble, there's too many things that can go wrong. I've heard of this not happening with colleagues, so I'm just not in that space. And that's a sentiment I heard back in June when I gave a talk at a critical care conference. And I'd say about half of the attendees were physicians who were over the age of 65. So when I went through my presentation and showed examples of what's happening, they were completely blown away by it. Just had no idea whatsoever what was happening.
And how would you? I mean, it's just one more thing to try to master, and it always seems like there's another thing coming up. I mean, that makes total sense why they wouldn't do that. I've also, and this is a strategy I like because I'm a journalist. I'm not going to lie to you. I have a couple burner accounts, and I use them just to kind of creep around and see what's going on, so that I don't leave a data trail, right? So that nobody can see where I've been, and that's just a great way to get information. I know that there are some, and I don't reveal who they are, but I know that there are some doctors who have the same thing, just so they can participate in the educational stuff, or just so that they can have a political opinion with no one being able to trace it back to them, because they're so frightened with it. It's beyond even being Googleable now. Screenshots, in my opinion, are the scariest thing going on right now. But I understand the lack of desire to participate because the risk is not worth the reward.
Right. And so my most recent thread that I just put up an hour ago actually goes into this and kind of illustrates this point. So I don't know if you saw
Looking at it now.
What happened. What's that?
I'm looking at your thread right now.
Okay. Yeah. So this was between Brett Stevens and a professor at GW, Dave Karp.
This guy sent them the email, right?
Yeah. So the email was posted on Twitter, and then I think 10 or 11 hours ago, I think this was kind of funny, GW's provost actually posted a screenshot of their response to the email. So yeah, the screenshots they're powerful, and they take control away from somebody, and an audience that you think might be just a few people actually can be the entire world if it goes viral.
And it's not the same thing as being able to delete a message or whatever. I find that I was a big fan of dating platforms, if that's something that you're into, until you realize the screenshot, like, man, your picture's on that and you say some weird stuff, and don't do that anymore. Like, I think this screenshot revolution has made it so. But on the other hand, it makes it, there's a weird sort of beautiful transparency to all of it. It's such an interesting time to navigate.
It really is. Yeah, I agree with you. And trying to figure out what that privacy looks like is incredibly important for anybody who's thinking about setting up a social media presence.
Sure. Go ahead.
I often encounter a lot of people who tell me that they're interested in joining the conversation, but they don't know what to post and when to post. Those types of questions come up. And honestly, I think having a strategy and a plan for how professional, how personal you want to be, and sticking to that, at least initially, is very, very important.
Yeah, that makes sense to me. I think that there are some people who, and you'll run into this if you're kind of thinking about dabbling and getting into it. There are people on Twitter and Instagram that have got it figured out. They have their brand down. They know when to be professional. They know when to be personal. Their audience gets them. Like, they're following it. They have a true fandom, but they're connected to other people. But you trying to emulate them is not going to work. You kind of have to be yourself. There are two people I've been trying to help out, and they are intimidated, and I've been telling them, just do the educational medical part and then dabble in other stuff as you see fit. But if you just stay true right now until you feel comfortable and literate, like, how do you teach someone who never downloaded Twitter what the hell a thread is, or how hashtags work? And if you click on it, it gives you all the things that are hashtagged, that kind of stuff. Yeah. There's no way to know.
Yeah. It has to happen face to face. I love doing workshops with beginners because it's just such an opportunity to present them with the positives of Twitter. I think right now, people who are unfamiliar with the platform and the conversations that are occurring in medicine and academia, they view it as problematic because who do we hear about all the time on the news using Twitter?
Yeah, I wonder who that is. Good call. I never thought about that. Wow.
So, yeah, if you put that in the context when you're talking to people who are new, I think it really helps.
Oh, that makes total sense. So you were doing engineering, and then someone recruits you to make a little bit of a career pivot. And what do you make of this new field? When I got into medical media, I found that it's like Hogwarts. It's like this parallel society, and there's an infrastructure, and there are codes of conduct and things I didn't know existed. It's a really fun and exciting thing. So I wanted to know what your experience was like switching gears a little bit.
Well, I love medicine. I think I'm the only one in my family who is not in medicine. Well, now I can say that I'm in medical education. But yeah, my dad is a doctor. My mom's a nurse. So I spent a lot of time growing up in the ICU halls.
Nice.
So it's an area that's always been really fascinating to me. And now that I'm in it, I have to say how social media is used by medical professionals is the most fascinating part of my job. And I'm definitely starting to transition away from the science communication work that I've been doing previously and trying to launch something that is mostly in medicine. I love interacting with all these different groups and hearing what their experience has been, who they want to target online, and helping them find that voice. So I hope that in the next 2 to 5 years that I will be more in this space.
Yeah, and I see that you are obviously comfortable lecturing, and you give talks apparently all over the world and all of this. So it seems like you're going to really dive deep. And it was really good for me because as I search the literature, there really is not a lot out there about how to do this. And you also, if you don't have a Twitter, get Twitter just so that you can learn a little bit from Sarah. if I'm not a student at Keck or at USC, what can I learn from you, and where do I find it? Plug yourself a little bit.
So yeah, my Twitter account is probably the best place to go because I'm posting there daily. And I respond to any DMs that come my way. So my Twitter handle is my first name _ last name, which is SARAH_MOJARAD.
Of course, that will be linked in the podcast notes, along with a bunch of links to different Twitter threads, including the one that got this conversation kicked off. And if you don't know what a Twitter thread is, it is multiple tweets in a row. It's basically, it's a blog. It's an article, but in tweets.
Mm-hmm.
And I don't love them because I like blogs, but that's just me being a stickler as a 29-year-old.
No, you don't do tweetorials?
I force myself through them. It honestly depends. So I found it's exactly like picking up a novel. If I pick up the Iliad or War and Peace, I'm like, oh man, hard pass. So if I see somebody 1 of 31, like, no, I'm good. I'll read the first one. Got it.
Mm-hmm.
But if I see like 1 of like 5, like, okay, I'll pay attention. And then I see on this thread, we get the screenshots of the emails. It's a picture book, so I definitely can cruise through those.
Mm-hmm.
But that's it's just the way I consume. I can't seem to. I don't enjoy it as much as I enjoy articles. But again, I went to school to write articles, so that makes sense, I suppose. I'll get over it. I'm sure I'll get over it. Yeah. So.
Well, that's interesting to hear because I don't number my threads.
No,
so.
you don't. You're a good writer because this stuff was so interesting. You're like influencer culture. Look at these people, and it's one of those things I got obsessed with after the documentaries, and it just, I am not jealous of influencers. I do want to know what their day-to-day life is for about a couple months, just to see. Like all the creepy DMs that some of these people must get, and like what are the comments, and how does it make them feel? And I kind of suspect that there's a weird relationship where your audience becomes like your self-worth. I just kind of want to dive into it. And in medicine, it's really intense because these are, patient advice.
Mm-hmm.
All right. Well, I think that go ahead.
No, I think it really is fascinating, and we haven't even covered. It's just we've only covered just a small component of it today, but.
Oh well, yeah, and we will. I'm going to do my best to kind of convince you to come back on the show every time something weird happens, and we need to break it down. Yeah, we'll have these little what the hell's going on social media tweetorial podcast things. We'll figure out a snappier name for it than that, but. Sarah Mojarrad, you can find her Twitter in the podcast notes and links to tweetorials and Twitter threads and a bunch of her videos and scholarly work in the notes as well. I want to thank you for coming on. It's a really important, fascinating conversation for the audiences, really interested in how to be online and what's okay. So thanks again for coming on. I really appreciate it.
Thanks so much.